how to choose a hospital for inpatient care. When it comes to healthcare, you have to make bold, wise decisions. Whether you are looking for a hospital for yourself your loved or your loved one, you should go you should go for that which best serves your needs. When you are admitted as an inpatient, the hospital becomes your home until you recuperate. For this reason, you must choose a good health facility, at least one that will meet your expectations and deliver good quality services as per your needs. This article discusses 8 factors that will guide you to choosing a hospital for inpatient care. These include 1. Quality of healthcare. In essence, a patient's health and well-being top a hospital's priority list. The hospital staff should therefore administer their patients with the best possible care. However, the quality of service differs in various hospitals. Some offer better services than others due to factors including, but unlimited to, doctors' qualifications. This may include their certification, specialty on certain medical conditions, number of successful procedures they have performed, among other considerations. Technological advancement on equipment. This chiefly includes the availability of state-of-the-art equipment and other instrumentation designed to perform specific procedures such as cell sorters, computerized tomography CT, scanners, magnetic resonance imaging, MRI machines, and more. General hospital accreditation. This is concerned with the hospital's recognition by government health bodies in its ability to meet the required health standards. You should choose a hospital that ranks well on all the above factors. A scenario may occur where you or your loved one needs admission into an ICU. As you are already in a delicate condition, you would expect to receive quality treatment. For this reason, you may get medical attention in an ICU in Idaho Falls or from another institution that offers quality services too, so that you may get back on your feet fast. 2. Insurance coverage. Healthcare is expensive, especially if you are receiving inpatient services, as bills would keep on accumulating by the minute. For this reason, you would want to make it easier for yourself and your loved ones by researching the insurance policies of the hospital and whether your hospital bill will be catered for by your health insurance plan. Make inquiries from your health insurance provider about the list of hospitals it covers, then make a selection from one of them. 3. Hospital standards. As a hospital is concerned with the health and general welfare of the patients and staff, certain additional factors should be carefully considered. These include security. Although unlikely to happen, a hospital may fall victim to incidences of robberies, terror attacks, hostage situations, and more acts of crime. You should ensure that the hospital you check into has minimal to zero histories of such incidences. It should also have ample security to tackle such a scenario if it arises. Safety. Ensure that the hospital's structural form is firm and its integrity isn't compromised. You may take a tour around the hospital or ask for references from people familiar with the hospital about the safety measures it puts in place, such as evacuation plans and equipment that may be used in case of natural disasters such as fires, tsunamis, earthquakes, or more. Utilities. Among many other essential services, a hospital should have flowing water and electricity connections at all times. This is because most processes are dependent upon these two main utilities. In case of any blackouts, a good hospital should have a working standby generator to cater for the power needs. Hygiene. A good hospital should have a good janitorial staff who will maintain proper cleanliness and hygiene standards at all times. The cleaning staff should work to ensure that proper standards are met that will protect patients from any infections that may arise from unsanitary conditions. To know about these conditions, you may research the hospital's history, ask reliable sources familiar with the hospital environment, or do a tour around the hospital to observe if their standards are high. And if they meet your expectations, you may choose that hospital for your needs. 4. Patient's experience. Patient experience. Among the qualities of hospital staff, including doctors, nurses, or even the cafeteria staff, is that they should be empathetic. You won't want to end up in an hospital with rude and neglectful staff. When admitted to a health facility, you should expect kindness and attention from your physicians. For this reason, you may request for details of patient surveys to learn what the patients have to say about the experience they received while at the hospital. You should choose the hospital with high reviews and hospital consumer assessment of healthcare providers and system scores. This indicates the gentleness and professionality of the staff, which will thereby make your stay in this institution easier. 5. Proximity. The closer or the closer a hospital is to your home, the more feasible your situation will be. For starters, you will easily and quickly get to the hospital and begin with your treatment process. Because of the proximity, it will also be easier for your friends and family to regularly check upon you. In contrast, this isn't the case for distant hospitals as it may take your family weeks of planning before they visit you. And at this, maybe just a few family members will visit you at any one time. The proximity will therefore make you feel more at home as your loved ones will be with you most of the time. Additionally, you will be familiar with the environment, and this will go a long way into reducing the loneliness that you may experience had you been admitted into a hospital far from your home. Also, there is a likelihood that you may encounter some familiar faces from your stay there, as most of the hospital regulars could be your neighbors, thus reducing the loneliness. 6. Visiting rules. A hospital stay can be lonely and even depressing, especially if you don't receive any visitors from friends or family. Some hospitals have strict schedules around patient visitation. While this is a practical solution, while this is a practical solution for issues like overcrowding and visiting at odd hours, it may not always be favorable for your conditions. For this reason, you may go for a hospital with more lenient policies, such as the hospital allowing your loved one to spend the night with you in the ICU and allowing for a group of people to visit you. The hospital can also have a flexible visiting program so that someone may come to see you at any time. This is because your visitor schedules may not always be in line with the hospital visiting hours. Other hospitals also monitor the gifts you may bring your patients. For instance, some of the hospitals with psych or inmate wards may prevent you from visiting your loved ones with any objects that can be weaponized, such as pens and other sharp objects. Despite this, your visitor should abide by the hospital regulations that the set rules have as the set rules have a reasonable baseline. For instance, there may be a case of confusion in in a in a hospital to the management so the management may limit on or entirely restrict visitation until the situation gets contained. Therefore, for the safety of your visitors, it will be best for them to stick to whatever visiting rules the hospital sets. 7. Local amenities. The presence of amenities around the hospital is another important factor to consider. There should be services and facilities such as cafes, hotels, ATM machines, banks, or other money sources, lodges and motels, transport infrastructure, among others. When your visitor comes to see you, it won't be difficult for them to get food, a place to spend the night, or the more they require. Additionally, you may also need these services during your hospital stay or upon discharge. On this account, you should select the hospital whose location will enable you to easily access these external services. 8. Movement equipment. You will want to choose a hospital that will make your stay there as convenient as possible. On this account, opt for one with infrastructure such as elevators, ramps, and gently sloping staircases that will make it easier for you to move about. Additional equipment may include wheelchairs and walking aids, all of which will be useful to aid you in your recovery process. Conclusion. Before you choose a hospital, ensure to do thorough research to ascertain the capability of the hospital to deliver the health care that you seek. Several factors will affect your selection of the hospital to receive treatment. These include the quality of health care the hospital offers, your insurance coverage, the hospital standards, the experience patients had when treated in the hospital's proximity to your home, the visiting policies, the local amenities, and the hospital and movement equipment. With all these factors considered, you'll be able to make a decision as to the hospital that will serve your needs best. When you get admitted into the hospital, you're likely to get a good experience as it will be the hospital of your choice.